It's 2 a.m. A loud noise awakens me. I get up to investigate the sound. I slowly make my way through the dark bedroom. A cold, wet sensation is beneath me. As it oozes between my toes, I know exactly what it is. It's the third hairball this week. This is just a fact of cat ownership, right? For the most part, my answer is no. Let's find out why. Hi everyone, I am Dr. Osk. My first hairball myth, hairballs are normal.
Hooray! Yay!
So why do cats swallow so much hair anyways? As your cats groom, those little spikes on the back of their tongue that point backward trap hair. Now normally this hair is swallowed, moves through your cat's digestive tract on its way to the litter box. For some reason, cats are given an exception here and hair is allowed to move in the opposite direction. I do not like saying hairballs are normal in cats. Too often this is chalked up as something cats just do. I think many times an underlying medical issue is either ignored or diagnosed later than it should be. If your cat is healthy, they should be able to pass the hair they swallow in a given day, including long-haired cats. So as long as there's no other issues, here are my hairball frequency guidelines. Normal hairball frequency is less than once a month. That's right, your cat should not be having more than a handful of hairballs in a given year. Cats that have hairballs every 2 to 4 weeks, even though this is abnormal, my worry level is still pretty low as long as there are no other issues. Cats that are having hairballs at least weekly have something going on and need to be checked out by your vet. So what do I do when a client asks, "Hey doc, my cat has hairballs, do I need to be concerned?" Is this actually a hairball? What does it look like? Where is it coming from? Hairballs are not balls. They are tubular structures, going to be pretty much 100% hair. This will be different from vomit, which would be undigested food, liquid bile. There may be a little hair mixed in, but not too much. Now, both hairballs and vomit are coming from the same place, your cat's digestive tract. I try to distinguish that from a common misconception and my hairball myth number 2, my cat coughs up hairballs.
Hooray! Yay!
This is physically impossible. Again, hairballs are coming from your cat's digestive tract. That's the stomach, possibly the upper intestines. Coughing occurs when your cat's respiratory tract is upset, the lower airways and the lungs. So why do I mention that here? Cats are great at vomiting and getting hairballs up. When I hear a client say, "My cat has hairballs, but nothing comes up," I immediately think, is this cat actually coughing and do we need to work up its respiratory tract? I think the reason why there's so much confusion and why so many incorrectly say coughing up hairballs, it can be very difficult to distinguish a vomiting cat from a coughing cat. They look similar. The reason this is important, respiratory issues are often ignored because we are under the assumption a cat has hairballs. I tell my clients, "Hey, I need to see what you're seeing. Send me a video." If I determine that cat is actually coughing, I want to see that cat sooner rather than later. We've determined the landmines in your household are in fact hairballs coming from your cat's digestive tract. My next question, how frequent are they? Cats having hairballs less than once a month, I'm not worried. Many of you are not worried. Cats having hairballs at least weekly, you've already made an appointment with your vet. Really, we're talking about my moderate hairball cats. Cats having hairballs every 2 to 4 weeks that are normal otherwise. There will be a couple of exceptions. The first exception is time of year, namely spring and fall. During this time, your cat is shedding. They're turning over their coat. They're swallowing more hair. You may notice a few more hairballs. The second exception is long-haired cats. On average, long-haired cats will have a few more hairballs than short-haired cats, simply because they are swallowing more hair. So for my moderate hairball cats, we have grooming and dietary recommendations. For the most part, you are already doing these. You're grooming your cat more frequently. You're brushing them more often. You've tried over-the-counter hairball treatments. Some cats do respond to these treatments. For the most part, they are pretty safe. There are few, if any, side effects, so it's worth a try. So by the time I get a hairball cat, you've done many of these recommendations. I'm thinking, is it time to change the diet? Based on your cat's dietary history, I may recommend a few things. I may recommend increasing canned food and decreasing dry food. If you haven't seen my canned food versus dry food video, check that out. I may recommend the opposite. Some cats are sensitive to canned food. I may recommend adding water to the diet or changing the diet completely. Some cats respond to a different brand, different formulation with different ingredients. Some cats respond to an over-the-counter hairball formula. No matter what the change, what I'm really interested in, how does your cat's body respond to that change? If the frequency of hairballs decreases, great, we ride that wave as long as we can. If the frequency stays the same or increases, I'm looking for an underlying medical issue. That brings me to my hairball myth number 3. Hairballs are harmless.
Hooray!
As you know, if your cat is having hairballs at least weekly, I am concerned. I'm recommending a workup. So my mind goes into a few places. Is your cat over-grooming and why? Maybe we have fleas, a skin issue, a behavioral issue, or increased stress in the household. Is your cat painful? Maybe we have a urinary issue or arthritis. Or maybe we have a true digestive tract issue like a food sensitivity, food allergy, inflammatory bowel disease, or IBS. Really, the goal here is to determine why is your cat having frequent hairballs before they have a partial or complete hairball obstruction, which is a very serious medical condition. That's it for me. Hopefully, I've convinced you that my 3 hairball myths are in fact myths. Hairballs are not normal, depending on their frequency. Hairballs are vomited up, not coughed up. And hairballs can be harmful or at least indicate an underlying medical issue. Again, when we talk about hairballs and frequency, we are assuming that everything else is completely normal. If you have any concerns about hairballs and your cat, please consult your veterinarian. Thanks for watching. If you enjoyed this video and learned a thing or two, please subscribe to my channel and like this video. If you have a topic you would like me to discuss, leave it in the comments section. As always, this video should complement your veterinarian's recommendation, not replace them. Please do not use this video to diagnose and treat your cat. And now, here is your
Cat fact.
Cats walk with a pacing gait. It is a two-beat gait where the front and back legs on the same side of the body move together. Other animals that pace using the cat's method includes camels, giraffes, bears, and some horses.